I want you to help here. We're going to redo this entire clean check. It's crap. View from 0. We're going to check every view. Okay, so there's some spaces there. All right, show me the lower view. Spaces there. And actually, that space is good. That space, we're going to ask for mesialization of the 5 and the 6 to fix your class 2 on that side. Okay. And then we're not going to worry about IPR. Please, guys, you help me. Now I want people to help here. Okay. What would your instructions be for the transverse? Show the center view, the front view at 0. Okay, guys. So what would your instructions be for the transverse? Everyone, transverse. Come on, guys, chat. I want you to help here. We're going to redo this entire clean check. It's crap. What would you tell the technician for the transverse? Maintain, yeah. No expansion needed. Perfect. Maintain transverse. I would say no expansion rather than maintain transverse. I would say, please do not expand any sides. Okay, done. Transverse done. Number 2, we're going to talk about vertical. You saw his upper incisal display. In fact, it wasn't 100%. Everyone agree? It was about 70-80%. So, everyone agree? Chat? Yeah. Yes. Okay, good. So, what are you going to talk about the vertical? When I say upper incisor display was 70%, what does it mean? Do not intrude upper incisors. Perfect. Now, this is what we're seeing at initial. So, how are we going to correct deep bite? How are we going to open it up? We can't intrude upper.
Lower posterior.
He's growing. Yeah. So, a combination of intrusion of lowers, slight intrusion of lowers, but a lot more extrusion of posteriors. Okay. If I could give you a rule of thumb, maybe at the ratio of 1 millimeter intrusion of anteriors, but 2 millimeter extrusion of posteriors, because they're still erupting. They haven't even fully erupted. And what happens when you erupt teeth in a growing child? When you extrude those posterior teeth in a growing child, how does it correct deep bite? What happens? What happens?
It opens the bite.
Flattens the curve of speed, yeah.
Yeah.
Big, come on. No one's saying it the right thing. Come on. What happens when you bring a tooth into its place? No. What happens when you
It
bring a...
reduces.
No one's thinking. Yeah, but bite opens. Actually, what happens? No. Dentoalveolar development. Okay. You encourage the dentoalveolus to come up with the root. So it's bone formation strategy. Okay. You have much more stable deep bite correction. You couldn't do this in an adult. You couldn't take an molar and take it up 2 millimeters because there's no dentoalveolar growth. There's no vertical growth of the bone with that. Here you're bringing bone along. That's the biggest difference in growth, okay? So even up to 3 millimeters, I'll extrude his posteriors because you see that lower 5 was still erupting, 2-3 millimeters. So vertical, transverse, we're going to say no expansion. Vertical, we're going to say, hello? Oh. Vertical, we're going to say, guys, what are we going to say? Vertical, do not intrude upper incisors. Intrude lower incisors, I would say 1 millimeter. And I would say extrude all my lower posteriors 2 to 3 millimeter. This is just a basic guide, right, for your draft simulation. Then I'm going to look at it visually and see whether that's correct. So for the draft, I'm going to say, because some of the teeth need 2-3 millimeters actually. Okay, so I'm going to say that. Vertical's none. Sagittal, class 2, how will we correct it? One side's class 1, so we have to tell them what. The left side is class 1. What are we going to tell them for the left side? What to do? What are we going to say? Maintain. Perfect. We're going to say maintain. Right side is half unit class 2. So what are we going to say? Correct to class 1. Perfect. We're going
Hi,
to correct
Dr. V.
the right
So
side
sorry.
to
Yeah.
class 1. Okay. So when we correct the right side to class 1, how are we going to do it? Mesialize lower. Perfect. We have lots of space, and we pretty much 95% of the time in a growing child will mesialize lowers.